Well, during the height of the pandemic, there was no place busier than hospital emergency rooms, which adapted to handle COVID-19 patients. Joining us now to talk about how things are now is Audrey Scott, Assistant Nurse Manager of the Emergency Department at Hartford Hospital. Audrey, welcome back.
Thank you so much for having me back.
Oh, you guys have been doing an amazing job. So tell us how you and your colleagues in the ER are doing after 3 months of fighting this pandemic on the front lines.
It has definitely been a long 3 months, but I'm so proud of how the team has overcome everything and come together as a team. I think we've all learned how to care for patients on a different level and connect with patients in a different way. So I think we've all come out better for it as caregivers and just as humans in general. And so I think we've all learned a lot from this.
I love that. I'm hearing so much of that. Well, now that the second phase of the state is reopened, has the volume increased in the ER? What are you seeing in these times?
It has increased. We're still seeing some COVID patients, although that number is down. What we're seeing is an increase of our typical ER patient. As everything reopens, people get back to more of their daily lives. We're seeing a lot of our typical patients, our trauma patients and injuries, and we're also seeing a lot of patients that may have waited for fear of COVID to come to the ER for certain ailments. And we just want everyone to know that it is safe to come in, and you may do yourself more good by coming in sooner rather than waiting.
All right, great advice. Tell us about the safety protocols and measures that you have in place in the ER. What can patients expect?
Well, safety is one of our core measures and core values at Hartford. Of utmost priority for us. We've just kind of adopted COVID as part of our daily routine now in the ER. So we're still following the highest safety measures. Every single patient that comes in is immediately greeted by a nurse and screened for COVID, and then placed in the appropriate area that's designated either COVID or non-COVID. And then we either will activate the isolation and PPE precautions if needed, or we'll go on to treat the patient as a normal ER patient.
And what if someone is positive for COVID? Tell us what goes into that again.
Sure. So if we screen someone as we think even the smallest inkling that they may have COVID, we immediately put them into a COVID treatment area where we would put them on isolation precautions. The staff would wear the appropriate PPE until the doctors or advanced practitioners can see the patient, we can test the patient, and we can determine whether they have or not. So if we even have the smallest suspicion, we're taking those precautions just to ensure everyone is safe.
All right, one quick last question. How proud are you of your staff?
I'm incredibly proud. I've been in my role about a year, so I'm not that far removed from the bedside, but I'm just so incredibly proud to be part of the team and see how strong through all of this and how they're taking such excellent care of all the patients, and that hasn't changed despite all the uncertainties in the last 3 months.
You have been in the trenches. Amazing job. Audrey Scott, Assistant Nurse Manager in the Emergency Department at Hartford Hospital. Thank you, Audrey, for all you do.
Thank you.
Thank you. Well,